So today, we announced 55,104 cases and 5,266 deaths in the state of Michigan. The rate of rise of cases continues to decline overall as a state. We also know that people are recovering. As of last Friday, 33,168 people have survived 30 days after being diagnosed with the disease. This is good news. On a regional basis, cases are steadily declining in Southeast and Southwest Michigan. Cases continue to be low in the upper Northern Peninsula and the Upper Peninsula. However, the Grand Rapids region of the state continues to have the highest rate of new cases per million people, with rates above 40 cases per million people per day. As we slowly reopen the economy, it will be important for us to monitor data, to make sure we are testing sufficiently, and to make sure we are swiftly responding to and containing any outbreaks. Even if cases are low in an area, it does not mean that all of the risk is gone. People should remain vigilant in all areas of the state, practicing social distancing, wearing masks, and washing hands frequently. As we move to reopen the economy, it will be paramount that we continue to expand and improve our data reporting so that the public has a good understanding of where we are with the spread of the disease across the state. We are grateful for the partnership between the Michigan Department of Health and Human Services and the University of Michigan to be able to develop the My Safe Start map, a dashboard that will help the public understand how the disease is spreading across the state and in their community. In this dashboard, local health officials and the general public will be able to understand where we are as a state with several indicators. This includes cases, deaths, and tests completed. This will be important so everyone understands where we are with the disease. We're also making great progress in expanding diagnostic testing across the state. Last week, our diagnostic test increased 5% over the previous week, with a 7-day average of 14,420 tests per day. The state of Michigan has received and processed more test results for COVID-19 in the past 3 months than we did for all reportable diseases in all of 2019. Today, we are announcing that we are removing even more barriers to testing, so that those who need a test can get one. As the governor mentioned, we are expanding our testing criteria significantly. Anyone, even if they don't have symptoms, can get a test if they have been diagnosed or exposed to someone with symptoms or someone who has a diagnosis of COVID-19, if they are leaving their home for work, or if they are determined to be a priority for testing by a local health department or a clinician, even if they do not have symptoms. And with the governor's executive order today, no one needs a doctor's order before they can go to a testing site. Nurses, pharmacists, and physician's assistants are now able to administer a test without a doctor's order. So anyone who wants a test can go to our website, www.michigan.gov/coronavirus test, to find a testing site nearest them. We have over 250 testing sites across the state, and we are expanding more and more every day. And many of these sites offer testing with no out-of-pocket cost. So again, I encourage people to seek out a test if you believe that you need one. COVID-19 is going to change the way we live for some time, but we are making progress because of the great work of all of you across the state. Things like social distancing, wearing a mask, and washing hands. We're seeing cases and deaths decline. But no matter what part of the state that you live in, COVID-19 is still a threat. Please do not let down your guard and remain vigilant. We will get through this.